Every year for the past 10 years we've been sending 4 medical students from the medical school at Notre Dame to Aboriginal communities in the Kimberley, the Goldfields and the Midwest, and they're working with WA Country Health Service staff on the Trachoma program to learn firsthand about the social determinants of health in Aboriginal communities. The preparation starts a few months before they are ready to go. The university works in partnership with WA Country Health Service. There's an orientation package for these students in particular, and they need to understand about trachoma, the disease and the biology of it, and they need to understand what their place in the trachoma program is, so exactly what tasks they will be doing, and they need to just be industry ready.
As a student, I was just trying to help the group wherever I could. So we would help weigh the kids for their antibiotic medication doses. We would do the paperwork, keep track of everyone we were seeing, interact with the kids to help, distract them and comfort them when they were getting their eyes checked. We visited residents in their homes. We got to know the staff of the local health clinics, interacted with the environmental health workers. We basically saw everything in the communities, from the shop to the clinic to the school.
Helping to shepherd the kids in as they are being screened. They're writing down the screening results. They might be helping to weigh children to decide what dose of medicine they need. They might be involved in giving the children the medicine, explaining to the children what trachoma is and what we're actually doing on this day. But that happens only because there's been many episodes over months working with the school, working with the Aboriginal community's leadership to allow this program to happen, so that on the day that the trachoma screening happens, we're welcomed into the community and everyone's ready for us.
I think it's an enormous privilege to be given this sort of opportunity. You're not just learning about a disease and the theory behind it, you're seeing face to face the social determinants of health. You're seeing face-to-face a public health program be delivered. You're getting in there, you're meeting residents of remote communities. You're welcomed into remote communities, which is so special in its own right. And you're learning from not just other health professionals, but you're learning from the environmental workers, the teachers, the elders of the community. You're learning about culture, about community, and how healthcare fits into all of that. It's incredibly different to being in the classroom, and I'd say I learnt more in those 2 short weeks in community than I could ever have done in a classroom.